Alpha-2 agonists, used therapeutically, decrease cardiac output in most animals. This decrease is due to A. Decreased afterload. B. Coronary vasoconstriction. C. High catecholamine levels. D. Increased myocardial oxygen consumption. Answer: B. Coronary vasoconstriction. Which of the following is a reason geriatric patients should be scheduled for surgery before young patients? A. Young patients become stressed more easily. B. Geriatric patients take longer to recover. C. Young patients need to eat more often. D. Geriatric patients do not have to drink so often. Answer: B. Geriatric patients take longer to recover. Which teeth are primarily used for cutting, shearing, and holding? A. Premolars. B. Incisors. C. Molars. D. Canines. Answer: A. Premolars. Which of the following is a correct statement concerning tissue samples? A. Once removed from the animal, tissue immediately starts to die. B. The process of autolysis is accelerated by cool temperatures. C. Fixing tissues hastens the deterioration of cell membranes. D. Tissues for standard histological examination should be frozen. Answer: A. Once removed from the animal, tissue immediately starts to die. All the following are true of veterinarian-client-patient relationships except A. The client and owner of the patient should be skeptical of the veterinarian. B. The veterinarian should regularly visit animals in the clinic or in the field. C. The client and owner of the patient should be honest with the veterinarian. D. The veterinarian should be on call and available in the event of an emergency. Answer: A. The client and owner of the patient should be skeptical of the veterinarian. Which of the following is a major disadvantage in performing fluoroscopic studies on animals? A. These studies are often expensive, so owners choose not to consent to testing. B. These studies' images can be saved in a variety of ways, including videotape. C. These studies expose veterinary personnel to radiation. D. These studies replace angiographic catheters. Answer: C. These studies expose veterinary personnel to radiation. Veterinary technicians may use the tape technique to examine an area of skin for all the following except A. Bacteria. B. Ringworm. C. Malassezia. D. Surface mites. Answer: B. Ringworm. After surgical equipment is sterilized, it is packaged and stored. Items can become unsterile if they are not stored or handled properly. Which of the following surgical items is still sterile? A. The item was stored in a humid area, and the packing is now wet. B. A technician pulled back the packing without touching the paper to the instrument. C. The item was stored in a pack that was punctured by another instrument. D. A technician pulled back the packing and touched the item with his forearm. Answer: B. A technician pulled back the packing without touching the paper to the instrument. All the following statements about general toxicology specimens are true except A. They should not be washed or submitted to extraneous contamination. B. They should be submitted in leak-proof and sterile glass or plastic containers. C. They should be collected fresh and then delivered to the lab frozen. D. They should not be individually labeled, only the largest containers need labels. Answer: D. They should not be individually labeled, only the largest containers need labels. Many veterinary clinics do not line kennel floors with newspapers because newspapers are not A. Readily available. B. Easily disposable. C. Absorbent. D. Warm. Answer: D. Warm. A correct statement regarding amiodarone, a common class 3 antiarrhythmic agent, is that it A. Has a low iodine content. B. Metabolizes to decethylamiodarone in dogs. C. Blocks slow-moving sodium channels. D. Is structurally related to carvedilol. Answer B. Metabolizes to decephalomyoterone in dogs. A correct statement regarding the use of atracurium as a muscle paralytic is it? A. Does not cause a release of histamine. B. Decreases intraocular pressure. C. Does not cause sympathetic stimulation. D. Is immediately effective. Answer C. Does not cause sympathetic stimulation. Technicians may occasionally care for cats experiencing Key-Gaskell syndrome. All the following statements are true regarding this condition except it. A. Is also known as feline dysautonomia. B. Affects the autonomic nervous system. C. Tends to appear in cats aged 3 years or older. D. Affects more cats on the West Coast than the East Coast. Answer C. Tends to appear in cats aged 3 years or older. In a generally healthy patient, an anesthetic that is administered intravenously will most likely take effect within a few A. Seconds. B. Minutes. C. Hours. D. Days. Answer A. Seconds. Veterinary medical teams wish to meet 4 goals when anesthetizing a patient for ophthalmic surgery. These include all the following except 2. A. Provide a mobile eye. B. Provide a pain-free recovery. C. Support cardiopulmonary function. D. Avoid increases in intraocular pressure. Answer A. Provide a mobile eye. A correct statement concerning a Michel's trephine is it is. A. Most often used for bone biopsies. B. Able to cut a square hole through bone. C. Only available in 1 diameter. D. Battery or electric power operated. Answer A. Most often used for bone biopsies. Which of the following urine preservatives is used for biochemical analyses of urea, ammonia, calcium, nitrogen, and uric acid in animals? A. Toluene. B. Acetic acid. C. Chloroform. D. Hydrochloric acid. Answer D. Hydrochloric acid. Which of the following types of antiseptical drugs is used to eliminate the presence of most species of tapeworms except Spirometramancinoides and Diphyllobothrium erinaceae in dogs and cats? A. Praziquantel. B. Niclosamide. C. Bunamidine. D. Albendazole. Answer A. Praziquantel. A veterinary technician receives a frantic call from a pet owner. From what the owner says, the technician concludes the owner's dog has consciously collapsed with dyspnea. In which of the following categories of emergency should the technician place the patient? A. Non-emergency. B. Minor. C. Serious. D. Life-threatening. Answer D. Life-threatening. During which of the stages of anesthesia does the patient react to external stimulus with a struggling reflex? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer B. Stage 2. Which of the following is a correct statement regarding the collection of animal feces? A. Better results come from feces collected from the ground or litter box than fresh feces. B. It is best to collect feces before collecting urine to avoid contaminating the urine. C. Feces collection usually requires restraining the animal so the process is uninterrupted. D. If it is difficult to collect the feces, it should be forced out of the animal using lubricant. Answer C. Feces collection usually requires restraining the animal so the process is uninterrupted. Thiacetarsomide sodium is most frequently used as treatment for A. Hookworms. B. Heartworms. C. Roundworms. D. Tapeworms. Answer B. Heartworms. Surgeons can use all the following types of powered equipment in an operating room except as /N. A. Oscillating saw. B. Pneumatic drill. C. Electric drill. D. Rotary saw. Answer D. Rotary saw. When performing colorimetric biological determinations, veterinary technicians may notice an abnormal change in the color of plasma and serum due to high chromatin levels. When performing this test on a grazing animal, such as a dairy cow, technicians may notice serum and plasma colored: A. Red, B. Green, C. Yellow, D. Blue. Answer: C. Yellow. Which of the following muscles should veterinary technicians avoid during intramuscular injections? A. Quadriceps group, B. Gluteal muscles, C. Triceps muscles, D. Lumbodorsal muscles. Answer: B. Gluteal muscles.